Have you ever had symptoms like low libido, sex drive, decreasing muscle mass, anxiety, depression, or just a worsening in quality of life overall? Well, you're in the right place, because I'm discussing how to alleviate these issues with testosterone replacement therapy, or TRT. But before we get into what exactly TRT is and how it can eliminate these symptoms, we need to know exactly what testosterone is so you can understand why TRT helps and exactly how it helps. For the layman, testosterone is an anabolic hormone that helps differentiate men from women, along with a multitude of other roles. The Cleveland Clinic describes testosterone in men as having purposes such as the production of sperm, the creation of new red blood cells, keeping your bones and muscles strong, as well as enhanced libido and a general sense of well-being. Let's look back at the symptoms we discussed at the beginning. Low libido, decreasing muscle mass, anxiety, and depression. We can tell these are all signs of low testosterone. Testosterone levels aren't consistent as you age though, and decline heavily in middle-aged men, which highlights a need for testosterone replacement therapy for middle-aged men. Dr. Alvin M. Matsuyama, a director who sees patients at the Grec Osteoporosis and Androgyny Clinic, found that aging men experience a decline in their testosterone in his review of the fundamental scientific aspects of androgen deficiency in aging men. Natural testosterone levels begin to decline due to a waning of the function of the testes and hypothalamic pituitary function. Certain cells in the testes, called Leydig cells, produce testosterone, and the number and function of these Leydig cells decrease along with age. Along with a decrease in Leydig cell function is the hypothalamic region producing less gonadotropin releasing hormone, aka GnRH, which typically stimulates the pituitary to release luteinizing hormone, which travels down to the testes, which secrete testosterone, meaning less GnRH results in less testosterone. This means that as men get older, after hitting their peak testosterone levels in their late teens, they slowly decline in their natural testosterone levels, which brings along with it significant defects. Dr. Jacob Raffier, MD, said in his journal article, Decreased testosterone in the aging male, that testosterone deficiency in the aging male is associated with a loss of libido, erectile function, depression, decreased cognitive ability, lethargy, osteoporosis, and a loss of muscle mass and strength. All of these symptoms are sometimes attributed to other psychological and physiological factors which cause testosterone to be somewhat overlooked in the medical industry, which is definitely a problem for men who have the condition of low testosterone. However, testosterone replacement therapy is here to remedy this condition and create better health for aging men. But what exactly is testosterone replacement therapy? Harvard Health Publishing describes it as a prescription testosterone injection or as a gel form of testosterone replacement therapy to restore normal levels of the manly hormone. However, the most common form of TRT is the injection form due to its increased bioavailability due to it being injected directly into the bloodstream. TRT acts by bypassing the hypothalamic pituitary region and introducing testosterone hormone directly into your bloodstream so it can carry out its functions as an anabolic hormone. TRT is not only based on this physiological mechanism, though, there's also many studies to prove its efficacy. One study done on men with low serum testosterone levels over 1.5 to 6 years found that along with increasing serum testosterone level to an average level, there was also an increase in positive mood parameters and libido, as well as an increase in lumbar spine bone density and a decrease in cholesterol and LDL cholesterol, aka bad cholesterol, despite a decrease in prostate-specific antigen concentration, which stayed in the normal range. There was a lack of detrimental effects for overall health. The results of this trial proved that TRT improves symptoms of low testosterone in aging men, such as positive mood parameters, lipids, and bone density when taken over 1.5 to 6 years. There was another study done in 2021 on 22 patients with congenital hypogonadism and age-matched BMI controls with regard to insulin sensitivity and body composition when on testosterone replacement therapy. This study found that TRT resulted in a significant decrease in waist circumference, truncal fat, total body fat, and improvements in lean body mass and insulin sensitivity. This shows that not only can TRT improve mood parameters and bone mineral density, can also improve body composition and insulin sensitivity, which go above and beyond alleviating typical symptoms of low testosterone. This improvement in body composition is due to testosterone's anabolic effect, which binding to androgen receptors on muscle cells further stimulate protein synthesis, leading to more significant muscle growth and repair. This increase in muscle mass further speeds up metabolism and decreases total body fat, as found in the 2021 study. However, while these benefits are profound, there's still a question about its safety, which is cause for careful consideration before usage. One of the biggest questions when it comes to the safety of TRT is cardiovascular risks. The hormone testosterone is associated with an increased red blood cell count, which we discussed before, which may in turn lead to an increased risk of blood clots, which have the potential to turn into cardiovascular events such as heart attacks and strokes. There's also the factor of the heart being a muscle, and like skeletal muscle, the heart has androgen receptors. So when you increase an androgen binding hormone like testosterone, you get an increase in heart size, which is detrimental to your health. This is called cardiomegaly. It has severe implications like reduced pumping efficiency, increased risk of heart failure, and compromised blood flow. However, this fear has been studied and it doesn't appear to be very serious in a therapeutic dose of TRT, with a study done on 5,200 participants with pre-existing cardiovascular disease and or risk factors for hypogonadism with fasting levels of testosterone under 300 nanograms per deciliter. And it found that after participants used a daily transdermal testosterone gel or a placebo gel, testosterone replacement therapy was non-inferior to the placebo concerning the incidence of major adverse cardiac effects. However, a pitfall of this study is that it was only looked at over 22 months, and testosterone replacement therapy is a very prolonged treatment. Another fear when it comes to testosterone replacement therapy is prostate health, and more specifically, prostate cancer. Testosterone stimulates the prostate gland's growth and function, which is a vital component of the male reproductive system. This means that higher levels of testosterone can lead to an increase in prostate size in the form of a condition known as prostatic hyperplasia BPH. There's also studies suggesting a potential link between increased testosterone and an increase in prostate cancer. However, the literature I have looked into does not indicate this association, with a study done on 44 aged men from 44 to 78 years old with low serum testosterone levels, and it found that TRT normalizes serum to androgen levels, but appears to have little effect on prostate tissue antigen levels and cellular functions. This study suggests that 6 months of TRT has minimal impact on prostate tissue and function. However, it suffers from a lack of a prolonged study length, with it only lasting 6 months. A major disadvantage and most significant consideration when thinking about taking testosterone is that you need to take it over the course of a lifetime or very prolonged. TRT causes the testes to not need to secrete testosterone, because when you're introducing it exogenously, the hypothalamus does not notice a decrease in testosterone, which it would typically do, so it doesn't release GnRH, which essentially causes the testes to not need to secrete testosterone. This causes the testes to atrophy, and biomedical says that the longer you've been on TRT, the longer it will take for your body to restart its normal testosterone production after stopping your protocol. However, it's possible to wean off TRT if taken in a short enough time at a low enough dose, but once the testes do atrophy, they can no longer produce testosterone. This and other potential adverse health effects like the cardiovascular issues or prostate health issues should be 100% accounted for when considering TRT, and you should basically talk to a health provider about these issues. While TRT isn't a godsend to alleviate all your potential quality of life detriments you may feel as you age and your natural testosterone levels begin to fall, it's something that definitely should be considered by a lot more people and should be, more prominent in the health industry. It should be considered, though, after the usage of other natural and free methods to boost serum testosterone levels. These methods would be to have a better intake of carbs, fats, and proteins, meaning these levels are more balanced, body fat around 10 to 20%, as well as regular exercise. These methods in combination will maximize your testosterone naturally and, improve your overall health as a whole. Although these methods don't always overcome the deteriorating testosterone levels I have discussed, so if TRT seems right for you, consult a health professional and, don't just take my word for it, and make that progressive change in your life to become more healthy overall. And don't let your testosterone levels, dictate your health. But that's gonna wrap up this video. And yeah, if you like this one, check out the other videos I have posted. I'll see you next time. Bye bye.